pregnant mama. If you are watching this video, it definitely means that you're pregnant, so first congratulations. One very common question that a lot of pregnant mothers ask is, can I exercise during pregnancy? What are the precautions that I should take, or what type of exercise can I do during pregnancy? So in this video, let me clarify all these doubts for you. But before we jump into the video, don't forget to subscribe to the Babypedia channel if you would like to watch more information about trying to conceive, pregnancy, giving birth, or taking care of your newborn baby. So hi. Hi, I am Saranya, the founder of Babypedia. I am a birth professional, a pregnancy coach, and a life coach for mothers. So now let's look at the first question. Can you exercise during pregnancy? Well, this depends. Okay, it is based on how healthy or how much of a risk factor there is in your pregnancy. If you already have any sort of discomforts, or you've had assisted reproduction wherein you went for treatments like, fertility treatments like IVF, IUI, you had any type of spotting, any type of pain in the early weeks of pregnancy, then your doctor may restrict you from exercising. They would recommend no exercise, or they would recommend complete bed rest. Another important factor is where your placenta is attached. When we become pregnant, what happens is the fertilized egg will break up into two and a placenta is formed. This placenta gets attached to the wall of the uterus, and it will provide your baby with all the nutrients that it needs to grow well during pregnancy. Now, this placenta can get attached in any part of the uterus, but if it attaches towards the lower part of your uterus near the mouth of the uterus, that's called the cervix, then your doctor may recommend no exercising or complete bed rest for you based on how low it is attached or how near to the cervix that your placenta is attached. Okay. So that is why we usually say in the first 3 months, try to stick to walking if you do not have any discomfort. If you have discomforts, please do not do walking also. After 3 months of pregnancy, around the 12th week, your doctor will recommend you getting a scan, ultrasound scan that's called the nuchal translucency scan. In this scan, your radiologist and your doctor will check on where the placenta is attached, and second, how well your baby is growing. Based on these two factors, your doctor may recommend that you can go ahead and exercise, or they may advise that, no exercise, you can just do your basic work, or sometimes even complete bed rest. Now, if your doctor has given you the clearance to exercise, then you can most definitely exercise. If not, please follow your doctor's advice, because they know your health, they know the risk factors of your pregnancy well. So it is recommended that you listen strictly to what your doctor recommends. Now let's look at what type of exercises you can do if your doctor has given you the clearance. So the first important type that you can do is walking. Walking is very underrated, maybe because there are so many videos of prenatal yoga or different types of workouts during pregnancy. But walking actually has a lot of benefits, like it promotes, your cardiovascular health. It also helps create more flexibility in the lower part of your body. It will help get your baby into the right position in preparation for birth. So walking is definitely recommended. Try to walk for at least 5 to 6 days in a week for a maximum around duration of 45 to 60 minutes. Yes, sometimes it can be difficult to walk continuously for that period. So when you have difficulty, you can always break it into 30 minutes in the morning, 30 in the evening, or 20 in the morning, 20 in the afternoon or evening, and another 20 at night. If you are a mother who has a higher chance or already has gestational diabetes, then walking for 15 minutes after every meal will actually help to slow down the food synthesis and also balance out your sugar spikes. So then you have started walking. What other things can you do? Stretches are a beautiful type of exercise during pregnancy, because during pregnancy what happens, your body is growing, your organs are being squished, your muscles, your ligaments are working overtime. So at this time, if you do gentle stretches that are specific for pregnancy, then this will help relax your muscles, your ligaments. It will help reduce a lot of the body pain that you are experiencing, all the aches and pains that you are experiencing, and it could help create more space for your baby to grow well and get into the right position for birth. So you could stretch for once or twice a week based on how much discomfort you are experiencing. If you have leg cramps, you could do leg stretches just before you go to bed. Another type of exercise that is very lovely to do during pregnancy is prenatal yoga, prenatal pilates, or you could also go for swimming. If you are choosing to swim, ensure that you do not, you are choosing a water body like a swimming pool that has clean water, so that you do not get any cold, cough, fever, or any other infections. Also ensure that there is not too much of chemicals like chlorine mixed in the water, because during pregnancy your skin may become very sensitive. So this can lead to pigmentation, itching, etc., and more stretch marks if you swim in water that has too much of chemicals. If you can get a source of very clean, neat water that is not going to cause you any infections, then please go ahead and swim. Swimming is a very great exercise because water takes the pressure away from your joints. It will also help your body and mind relax. You could also go for pregnancy yoga, Pilates, or medium low impact dance workouts. But whatever type of exercise you're choosing, be it yoga, be it Pilates, please choose to learn from somebody who is certified to teach pregnant mothers. Not all yoga classes are designed the same way. You can't walk into a class where the teacher teaches you general yoga and ask them to make some tweaks for pregnancy. There are some asanas, there are some restrictions that will be followed when you are pregnant. So for that, you need to go to somebody who's learned about a pregnant mother's body type, what are the precautions that have to be taken, and they will help you much better. You could sign up for online classes, you could sign up for in-person classes, that doesn't matter, but sign up with somebody who is trained to teach pregnant mothers. If you have already been doing strength training, you've been visiting the gym, lifting weights, and your doctor has cleared you for exercise, you can continue to do so. But again, you need guidance from somebody who will help you during pregnancy. You can continue to lift around 70% of the weight that you've been lifting before, but always take precautions. Do not exercise or walk when you have any of the following symptoms. You're feeling dizzy, you're feeling nauseous, you're feeling extra tired, you have any type of overall body ache, you have some cold, cough, infection that is draining your energy, and situations like these, then please ensure that you are not exercising. When you are exercising, remember to keep hydrating yourself. Keep sipping on water. Don't gulp, but keep sipping on water. Have a snack before you work out and have a snack after you work out to ensure that you do not get too tired. Okay, so these are some of the recommendations that I have for you today when it comes to exercising during pregnancy. I think you would have gotten a lot of information. If you really like this video, don't forget to hit the like button, share it with another pregnant mother, and subscribe to the channel. Take care. I will see you soon in another interesting video. Till then, bye bye. This is Saranya.